Self-Direction Virtual Conference Series. My name is Casey DeLuca, and I'm a Vice President at Applied Self-Direction. Thank you for joining us today for the session, Self-Direct Sustainability Planning. What happens when a caregiver is no longer capable or alive to administer the self-direct model of care? I'm going to run through a few quick housekeeping issues before we begin. Your microphone has been automatically muted. Due to the volume of attendees, please remain muted throughout the session. You can submit your questions and comments at any time by using the Q&A pod in the lower left-hand corner of the Adobe room. We do have time reserved at the end of the session for your questions. All questions and comments will remain anonymous. This session is being recorded and will be available on our website. Closed captions for the entire conference series is available courtesy of our premier sponsor, Avero. You can access the closed captions by clicking on the CC icon at the top of the Adobe room. I am thrilled to introduce our speakers for today's session. Rita Young is the owner of Rita Young & Associates, a mission-based consulting firm with the goal of supporting positive outcomes for people with developmental disabilities through training initiatives, project management, and advocacy. Rick Thompson is co-founder and executive director of Champions Community Foundation, an Atlanta-based charity whose mission is to empower physically challenged young adults to reach their full potential for independence and belonging. So with that, I will turn things over to Rita to get us started.
Hello, everyone, and thank you so much for joining us this afternoon. Again, my name is Rita Young, and I want to thank Applied Self-Direction for inviting us to present today. Casey just talked a little bit about the work that I do, but before we get started and I turn it over to Rick, yes, I work in this field, but at my core, and I'm sure Rick will echo this as well, I'm a parent. And I self-direct services for my two adult sons that both have autism and have been doing that for over 10 years. Also, and that's the other reason that I believe that this issue is very critical to families. Today, we're going to give you a snapshot of our work in Georgia to address this particular issue of sustainability planning. To let everyone know, we are in the discovery phase of this project. So some of you that are listening today may be a little bit ahead of us in terms of discovering some possible solutions. Some of you may have not started, or some of you may be a little bit in between. So I just want to acknowledge that we're here to present some of our discoveries in the hopes that will inspire you as well. Lastly, before we get started, we will be presenting some slides, but then at the end of our presentation, we'd love to have your questions and love to get your input as well. So we'll have some questions for you at the end of our presentation, and to the extent that you would like to provide that feedback, we would absolutely welcome it. And so with that, I would like to turn it over to Rick to get us started in the presentation.
Thank you, Rita. Yeah, Rita and I both have the honor of having two special needs children each. My daughter and son, Katie and Matthew, both have very rare form of muscular dystrophy. So Rita and I have a lot in common. We're going to take you through our thought process today, and a journey that started about a year ago. And we're going to start off with the advantages of the self-direct model. And this audience is well aware of these benefits, but we thought it would be good to restate them. You know, it's when you think of things like freedom of choice and self-determining your services so that you're out in the community, those are a big deal. And I'm going to give you an example in a minute of where my son lives and where we think it's working. Actually, I'll just dive right into that. My son works at a facility. It's not a facility, it's an environment, shared living environment that is specifically designed for young adults with physical disabilities. It's pretty cool. It's, hey, Google, open your blinds. Hey, Google, turn on my TV. Hey, Google, call Dad. And it's neat. But one of the best things about Champions Place, though, is that we self-direct services there. We have families that self-direct services and actually share employees and DSPs. And what's your father's name? If you're hearing that in the background, I actually have a Hey G in my room where my son calls me. So I apologize. That was unplanned, but maybe it's appropriate. I'm not finding a match in your contact. So as a result of the self-direct model, our son and his friends are out in the community. They're working, volunteering, going to church, working out at the local fitness center together. And it's all because of this self-direct program, we believe, where they can have this personal choice. They are involved in the actual hiring of the DSPs at Champions Place that work for them. And again, we do share employees there. You might want to check the contact. And they're involved in the recruiting and hiring, training, ongoing management. Most of the annual budget actually goes to paying the DSPs because, as you know, many of you are fiscal agents, and that is a very efficient way to manage our funds. So we either pay more or can provide more hours. And we can, and as a result of that, we have reduced turnover in our environment. So all this is very wonderful, but the catch is it's a lot of work for the parents. And, you know, this is probably not new information, but whether you self-direct or not, there's a lot of parent responsibilities. Managing SSI or SSDI, if that's the case, you know, your medical issues that you're managing every day as a parent for your son or daughter, medications and doctor visits and durable equipment, managing the Medicaid waiver itself. If your son or daughter is working or is seeking employment, it's quite an effort to do that through supported employment. In our family, we manage a stable account to ensure that we keep money out of our son's name so that he qualifies for SSI. SNAP, food stamps. It seems for some reason we need to reapply every quarter these days. It takes a lot of time. Management of a special needs trust to make sure that we're prepared for the future. And then all the other many things that we do on a daily basis, like filling in for caregivers and shopping and just attending to our son or daughter. And this is whether or not you self-direct or not. Add on top of that, a parent's role in the self-direct management process. And many of you are intimate with these, from recruiting, which is a little bit more difficult today with a shortage of DSPs nationally, the interview process and timing that in with your personal commitments and job, and including your son and daughter, onboarding them, training them, and retraining them and training them again, scheduling the activities for your son or daughter, approving time, the ongoing management of your budget and making sure you're staying on budget and optimizing it, you know, managing job performance, complying with EVV. You can finish the rest of the list because you live it every day, up to and including acting as a caregiver yourself. And with, you know, this 3 slides of responsibilities, 2 specific to self-direct, most parents still choose to stay with a self-direct model because it works and their son and daughter are happy. And so we choose to do that. It takes a tremendous amount of time, maybe up to 20 hours per week as a rough number. And the self-direct trends are increasing. Here in Georgia, we have almost 4,000 folks that self-direct today, and for all the reasons on the left-hand side. And I think this is a national trend. Matter of fact, here in Georgia, it's grown to almost 30% of the total number of people that enjoy the support of waivers today. in Georgia. So there's a lot of people on the program today. And we know that many of the folks here listening are fiscal agents. You're probably feeling the burden from that with the increase of folks choosing to go self-direct. But all this leads to an emerging challenge, and that is what happens, and that's the topic for today, in the self-direct caregiving model when a parent is no longer capable or alive. You know, this isn't being flippant, but the death rate is 100%. And this issue is not going to go away, and it needs to be addressed. And we don't think that it's practical or realistic to assume that a sibling, relative, or friend could assume the role that a parent fills today. So about a year ago, I put together this series of slides because I was up at 3 o'clock in the morning, and I went and I reached out to our director of Medicaid, and he was nice enough to meet with us here in Georgia. And after listening to this train of thought, he said, you know, I'd like to introduce you to somebody that's asking the same questions. And her name is Rita Young. And so Rita and I connected. And as a result, Champions Community Foundation, we have hired Rita to lead this effort. And we've made a lot of progress in the discovery process here in Georgia. And so Rita, why don't you take it from here and share that story?
Absolutely, Rick. Thanks so much. So we have been together only since August of this past year, but we've managed to get quite a bit accomplished. So just to give you a little bit of an idea of who we are, and it's important to note here that this is a family-driven project. So we are a group of about 12 family members, self-advocates, and allies that all self-direct services, and an additional 12 families that are represented, that Rick represents from Champions Place. Again, we just started meeting last August through this month, and we'll continue. We are families that either have an IDD waiver in Georgia, and I know that everybody calls it something different in across the country, or a waiver specifically for individuals with physical disabilities. We are all pleased with the self-direct model. And as Rick mentioned, the Champions Community Foundation is our sponsor, and we have been meeting consistently for the last 7 months. In addition to that, we found that it was also important to reach out to other organizations outside of the state of Georgia to learn and collaborate and to share our knowledge and findings. So we reached out to Applied Self-Direction, and thank you so much, because Applied Self-Direction connected us with others like the Self-Direct Advocacy Network of Maryland, Rhode Island Self-Direct Coalition, a great agency that serves New Jersey and Pennsylvania, Values into Action, Human Services Research Institute. We also talked to folks out in California along this journey. And also to note that our DD agency in Georgia, which is called the Georgia Department of Behavioral Health and Developmental Disabilities, along with our Medicaid agency, Georgia Department of Community Health, both attend our meetings. So we are doing this in collaboration with our state agencies. We also have a provider organization, Georgia Options, that is sort of top in class in Georgia, as well as our parent organization, Parent to Parent of Georgia, and another organization that focuses on housing options called Better Living Together. The first place we started and what we discovered is the study out of New York. So if we have folks from New York, we thank you for starting this particular research. It was a very well done study that focused on sustainability, and it was developed and written by the fiscal agent, one of the fiscal agents in New York State, as well as the Institute on Community Integration at the University of Minnesota. The conclusion of this very well done report, which you can access, we have the link at the bottom there for you, is that self direction is excellent for individuals who have a disability as long as the parent is alive and capable of administering the model. So what we decided to do, and this is fresh off the press, is we decided to poll families in Georgia that self-direct services. We are very fortunate that Parent to Parent is one of our partners in this particular project, and they hold a contract with the state of Georgia to provide training for self-direct families. So they were able to send an email out on our behalf with several important questions that we think will help us along this journey. So we were able to survey roughly 300 parents across the state as of Monday. And we did find out that parents are 86%. They are the majority of the administrators rather, of the self-direct model. We also found it important to ask the ages of the employers of record. What are the ages of people that self-direct in Georgia, the administrators? So of those parents, 55% are in that category that's over 60 years of age, which we would consider an aging caregiver. So 55%. We also wanted to ask, how concerned are families about sustainability? And as you can see here, we have 84% of those that responded have concerns about sustaining the self-direct model of care. And then one of the last questions we asked is, when you're no longer here, what are your family's wishes for your son or daughter? Interestingly enough, we found that 71% want to continue to use the self-direct model in their existing home, the existing home that their son or daughter lives. So they want to keep that model, have someone administer it. 16% are going to switch or have decided they will probably switch to a group home or a host home. And then 13% want to switch from self-direct to a provider providing services in their existing home. Again, I think we've stated this before, but when a parent dies, a critical role is left vacant. If you recall the slides of all the responsibilities that as family members we do, it will basically take a team to replace an individual family member. So we thought about, what if we do nothing about this particular issue? What could be some possible implications here? And you all might be, in terms of the different industries that you're working in, you might find this helpful. But upon the parent's death, who will manage the care? So if we decide to do nothing here, there's going to be quite a few folks that will not receive care or need emergency care. When this happens, will traditional providers have the bandwidth to absorb more participants? So here in Georgia, as Rick mentioned, close to 4,000 families self-direct. Probably our provider network would not be able to absorb that number of individuals easily. And with more and more people choosing and moving towards self-direct nationally, isn't this problem going to get worse? Something else that we've discovered, and it sounds like we have some folks from Maryland that are listening today, and those folks have been extremely helpful. We discovered we don't have a support broker role in Georgia, but other states do. And this is possibly a step for us in the right direction of being able to solve this puzzle. So a support broker, as you all know, there are support brokers listening today, assist families with the details and management of services, help with the planning process, recruitment, hiring, scheduling, firing of staff, budget planning, and in Maryland can also provide direct support if needed in an emergency. So We also found that the support broker role may look different in different states. And we've given you a link here if you would like to check out some current legislation that the folks in Maryland have passed and did a tremendous amount of work over several years in order to make some positive changes there. So what we did, thanks to the folks in Maryland and other places, is we took the role, the support broker role, and customized it, tailored it just a little bit to Georgia. And so if you look at this, it's basically the same job description. We're changing some of the lingo here. Why reinvent the wheel? This is a draft job description. We'll continue to look at it, but the team, all of us, our work group, worked on this particular job description and agreed that this is the direction that we'd like to explore next. So again, a support broker advocates on behalf of the person. We talked about the recruiting, the budget, managing the services, supports and services, working with a fiscal intermediary, et cetera, and working on the individual service plan, being a part of that team. We also started brainstorming about what this might look like for us in Georgia, specifically that sustainability piece. So for the sustainability purposes, we think, it's our opinion, that the service needs to be offered through an organization such as a provider. Could this role and new service be created as an agency light model, something that is less regulated and expensive? Thinking in terms of budgets, et cetera, limited budgets that we have here in our state, could we perhaps begin to offer this to families with aging parents so it's transitioned prior to their death, or to assist single parents or parents with chronic illnesses? So these are some of the things that we're exploring. And Rick, I'm going to pass it back over to you.
Yeah, so as we started to think about the different ways that this could help, and if you took your average self-direct family where the parents are involved today, and let's say that as the parents approach 60, or they are a single parent that needs additional help, or perhaps that parent has a disability or chronic illness themselves. They just can't manage the self-direct program, but it really helps their son and daughter. So could you have a second kind of continuum where you could self-direct, but with broker support? And then perhaps when, and all these scenarios are different, and I guess the arrows could go in different directions, if somebody required more support, and it required more than a support broker could provide support for, would it then move to a more traditional care model? And one night I was home talking to my wife about this. She goes, Rick, that sounds a lot like where your mother used to live in senior living, where it starts with independent living, moves to assisted living, and on to something more involved like skilled nursing. So we think it would be good for there to be a continuum of services that could support somebody through their life. And as we talked about this service, we talked to somebody on our team here in our state Medicaid team. And, as he was listening to this, his name's Jeff, and he said, could this service just make it more palatable and practical for a sibling to take on this responsibility when the parent no longer can? Today, the way it sits is, oh my gosh, how would you hand this to your a sibling, another son or daughter, to manage all of this for your physically or cognitively challenged young adult? And it would just consume their life. It's just not practical. So could this additional service make it more practical and palatable for them to take it on and support their brother, sister, cousin, friend? So with that, I think, Rita, we are to next steps.
Right. So our game plan is to continue working with our state Medicaid office to explore the possibilities of a support broker role in Georgia. And that we understand that's not going to happen overnight, but it is part of our game plan. And then to develop a cost analysis to justify the need. So, right now in Georgia, we're going through an IDD rate study. And the final draft of that, or the final recommendations, were just released yesterday. So I think our timing is pretty right on here to try to figure this out. And then we will be meeting and in the future offering this to policymakers as a cost-effective alternative to traditional IDD services. So again, we're looking for what the path is, what actions might we take next after our discoveries. What we would like to do at this point in time is to take questions from those that are watching, and then we do have some questions for you all as well. So, Casey, would it be possible for us to go ahead and jump into the Q&A section at this point?
Definitely. Great. Thank you so much, Rita and Rick. We've gotten a lot of questions that have come in during your presentation. So just a reminder for folks, keep submitting your questions and comments. You can use the Q&A pod in the lower left-hand corner of the screen, and we will get to as many as we can. So first question we received. Why do you say it is easier to recruit and attract more qualified candidates when self-direction cannot provide health care and other benefits? We find it very difficult to find providers along with others in our state and nationwide due to shortage of workers.
Rita, I'll take that because I think it came up during my section and it could have been, how I worded it. So first of all, this is Rick, obviously. I would say that I'm not saying that it's easy to find caregivers and DSP candidates today. What I meant to say is that as our personal experience as families, we started off with a more traditional model. And then when we moved to a self-direct model, we did that because we realized we could pay more per hour and use more of our budget for the actual towards caregiving itself versus it going in a more traditional model where there's more overhead. You're right. We're at a little bit of a disadvantage in that we don't have healthcare built in, but we have been more successful. All the same. I would say at Champions Place, a lot of it has to do with the environment. It's fun. It's interactive. There's engagement with more than one waiver participant at a time, and I think that's an advantage. Just the social aspects of it, but the point I was making, whether it applies in your state or not, is that we can pay more because less is going to agency overhead. I said a provider overhead. So I think, Rita, I don't know if you'd add to that.
Well, so just a couple of things. I don't have the exact numbers in front of me. Georgia, the published rate by our state DD agency, now again, some providers are paying more than this, currently is about $10 an hour. And what I hear from providers is I think the wages go up to about 14, maybe at the top, 15 an hour. Now, it looks like the proposed recommendations will be a little bit higher than that. And again, this is what I'm saying is anecdotal. From the families that I talk to, we are able to pay more than that, as well as provide, as Rick mentioned, a nice working environment, a flexible working environment as well. So yes, we can't pay health insurance, et cetera, but there are other benefits working directly for families one-on-one.
The next question is, I'm wondering who developed the housing. And So that is Champions Community Foundation. Quick story, because I'll make it quick, is that as we looked about 14 years ago around Atlanta, the Southeast, and around the country for an independent living scenario for those with physical disabilities, like cerebral palsy, muscular dystrophy, spina bifida, we could not find anything that was really built specifically for that population. And we feel we've got one of the few, if not the only, that has been built specifically with that objective in mind here in Atlanta. So that's the genesis of that, but that would be a whole other seminar.
And Rick, we actually received 2 other questions about the Champions Home. So let me just bring those over.
Sure.
Could you explain exactly what Champion is? Is it a residence? And then how many individuals live in the Champions Home?
Yeah, so this will get a little complicated, but we are not a licensed facility and we are only a landlord. So as everybody knows with Medicaid, you cannot be both a landlord and provide services. So we are a landlord. Our foundation built this facility that is accessible, has automated doors, has a lot of assistive technology. And then the folks that live there, there's a mix of waivers. There are some that don't require support. They're they can ambulate themselves, but they self-direct their services. The families themselves manage their services just like they did when they lived at home with the parents. And by living together, they have the ability to share caregivers. And so if you look at a scenario at home where it's always one-to-one versus where you live in some parts of the day, you could be one-on-one if appropriate. You could also be 2-on-1 or 3-on-1, meaning 3 residents or 3 participants to a caregiver. That allows us, if you average 2-on-1, to take $1 of Medicaid and turn it into $2 of Medicaid support. So it's been a pretty successful model. We've only been open about 2 years, but again, our foundation, there's 2 different entities, one that is the landlord and a separate entity that manages the services, and the family self-direct.
I see another question for.
Yep.
Oh,
so then the next question we have is specific to Georgia. Is there a wait list for services for the waiver in Georgia?
Yes, we have a wait list of about 7,000 individuals in Georgia that are waiting for services, specifically on the IDD side.
Okay, the next question, how can the parent be the employer of record in a self-direct model?
That is an interesting question. I assume that is the way it is administered in other states. As family members that administer we are the PD administrators, we are considered employers of record. So it sounds like that may be different from the state that you are in, but that's how it is handled here in Georgia.
Yeah, and I think in a lot of states, the individual who's self-directing is able to select a representative, which in many cases is a family member, like a parent, to help them manage their services. And so, but then, yeah, they cannot be paid in that role, but they can act in the best interest of the individual self-directing as their representative.
Right, and that's what we're doing. As a family member, we just jump in and do the work, right? So I understand where that question is coming from, and I don't think I really answered it, but I do appreciate you bringing that up, and thank you, Casey.
Sure.
Yeah, and obviously we as parents, we're not compensated. That's probably
right.
us. Yeah.
Mm-hmm. I'm seeing a couple of questions coming in from New York folks, where in New York, they use an agency with choice model, which is different from the fiscal employer agent model, where the person self-directing is the employer of record.
Wow, we'd like to know more about that.
Yeah.
Okay, next question here. Do you have any families in your support group that have very low functioning individuals in their care?
Yes, we do. We have several that have more intense medical needs, and we do have several that have more complex behavioral support needs too.
Rita, isn't there a limit though to who can self-direct? Is it 24/7 or is it skilled nursing? Do you recall?
You cannot self-direct nursing services in Georgia, right? You have to use traditional services. So perhaps that's where the question came from.
Yes.
But you can choose particular services to self-direct, and then nursing care, from what we are learning from our work group, you're not able to self-direct. You have to use a traditional agency and service for that particular service.
Okay, next question. Will the support broker fill open shifts?
This is Rita. If we are able to get support brokers as a service here in Georgia, that would certainly be a consideration. Again, we are in the discovery and exploration phase of the project at this point. So we still have quite a bit of work to do. But thank you for giving us that question and consideration.
Yeah, I think this next question is very similar. We're in the discovery phase, and if there are support brokers out there that have a range of support that, ratio support, whether it's, I wouldn't even want to put out a number, because we have reached out to a couple of states to ask them that question. So if you have input for us, that would be very helpful. Again, we're developing the service and we're in the discovery mode.
So if you have a ratio that you feel that it is provides the most person-centered care and support, we would love to hear that. 1, 2, however many. So the New York study, yes, the next question, and there are quite a few states that have support brokers. Again, we are all on different points in this journey. Some of you all are ahead of us, right? And we're just trying to catch up here in Georgia. So I certainly understand that even having a support broker may not 100% solve the issue that we are trying to solve, but it moves us at least in the right direction and on that path. If you've discovered something else, and as we go through the questions, we'd love to hear that today.
Great. And that was in response to, we'd received a comment about the New York study cited earlier in the presentation, determined that self-direction works when the parents are alive. This is despite having a support broker position, which does look somewhat different than the one that was described from Maryland.
Yes.
Okay. Next question. Are you suggesting building palatable institutions using self-direction dollars? What about the HCBS settings rules?
I don't know what they mean by palatable institutions. It moved on me. I'm sorry. The question.
Yeah, I think the question just jumped.
You should be able to see the question in the upper left-hand corner.
Oh, I see.
Of the screen right here.
Okay.
I don't think that that's what Rick is suggesting. But Rick, I'll let you, if you would like to address that, because I know that you worked very closely with our Georgia Medicaid in developing your project.
Yeah, so I don't think we're working hand in hand with our team here. So I don't think they've been on site. HCBS for setting rules. I can tell you where we live, personal choice is probably as strong as any place that we've seen. So the feedback's been great. So I just don't understand the term palatable institutions. So my apologies.
Okay. And I think the person that asked the question, if you wanted to follow up and elaborate a little bit. The next question, if brokers are the solution for replacing parents, where do these brokers get training?
So again, we are in the exploration phase here, but I will say we have discovered, because of some of the connections that we've made, that there are quite a few states. Again, I'm thinking of Maryland and Pennsylvania that have already developed very solid training for support brokers. So we'll be starting from scratch here, but it seems like there are others that are ahead of us on the journey that hopefully we'll be able to learn from and be inspired by.
Okay, next question. If someone needs a support broker to do all the duties, why not just stay with traditional service providers?
Rick, I can take that unless you want to jump in.
Well, I'll support you if, yeah, go ahead.
Okay. The families in Georgia that self-direct are pleased with the services. Years ago, I will say in 2017, I did a series of town halls across the state of Georgia. And we asked the question, what are you like? What are some challenges? And the number one service that folks reported was self-direct, that they are pleased with the self-direct model and its utilization. Um, and Right now in Georgia, as in across the entire country, there are workforce shortages. We have day programs closing. We have group homes closing here in Georgia. We are also, I just talked with a parent the other day. Again, it's just one parent that's really being encouraged, that just received a waiver, to go self-direct because of the challenges in workforce here in the state with traditional providers. Also, parents, we talked about the advantages early on. It's person centered. We select who our family members work with. We're part of that interview process, as our family members are as well. Um, so it gives families more freedom um, to direct where those waiver funds or how those waiver funds are utilized. Rick, you might have something else to add to that, but that's my opinion.
No, it's my opinion too, is having done traditional services and self-direct in our family and watching other families do it, there's a real hesitancy to move back to traditional because of the success that is being had, and just the result of personal choice, getting in the community and having control of the money to be spent in the ways that it is today, to get them out in the community, working, volunteering. We just didn't have the same experience. And we have much more, we think, stable model with people showing up and the quality of people that show up. That's just our experience as parents.
And I will also say, my younger son has some behavioral challenges. I don't know if there's a provider that would be able to address that, quite honestly. And so, that's one of the additional benefits, is to be able to find and train to create our own team to be able to support our loved ones in the home, if that's what we choose to do.
Yep. Yeah, that's just, I think Rita and I are just saying that's our experience doing this for 10 to 15 years. That's just personal experience.
Okay, so I see another
And
question.
then
Is your
the next, oh, sorry, Rita. The
No,
next
go ahead. Go
question
ahead.
is your proposed sustainability service model to give support brokers more responsibilities once the parents pass away? And then a related question here. We have support broker role in New York. What do you envision the additional support broker responsibilities once the parents passed away?
Yeah, so we wouldn't know what they are in New York to intimately to say what additional would there be. Um, I'm looking at the wording of the first is your proposed service model to give support broker more responsibilities. I think there's a point where you cannot assign certain responsibilities over to a support broker. Budget approval, for example, is one that probably there's a line that needs to be crossed. But the discussion we had with our team here, our state team, an example was used of doing your taxes. So if I can do my taxes at home, or I can go to a CPA. Either way, I have to sign off on them. I have to review them. I'm responsible for them. But my CPA does the work. While an oversimplified example, I think it's a good one that drives home the point that the parents aren't going to be there. These folks are going to need the support, but there's a point where a sibling as an executor or guardian would need to step in to make those decisions. But they wouldn't do the day-to-day management of the process. Rita, what would you add to that?
I would just add that again, we're on this exploratory road. We don't exactly know where we're going to end up. It's going to be quite a bit of work for us just to get the support broker role in Georgia, I'm imagining. And so you all are bringing up some really great questions, but keep in mind, we're just trying to catch up with our folks in the Northeast. We're not there yet, so we may not have all of the answers specifically to your questions.
And Rita, we've actually received a lot of comments from folks that would like to connect after the session. So I'm just going to advance your slide here so folks can see your email address.
Thank you, Casey.
So that some folks who have some ideas I wanted to chat with you about some stuff can reach out to you.
Terrific.
We received the following comment. I would add that support brokering is a fantastic support. It is best coupled with strong person-centered planning across the years to build a team of people who care about the person. We can find people to care for, but who cares about the person who can direct the support broker and ensure the person has people to help this vision? Building this team over time for the long term when the family is gone.
We'd agree with that.
Well, I absolutely agree with that statement. Thank you.
Okay, the next question is about your work with the state. Is the state helping to come up with alternatives for how to manage when parents can no longer do the work? And what plans do your families have in place for when parents can no longer do the work?
We're very fortunate that the state attends all of our meetings. We meet on a monthly basis, so they are we could consider them a partner in this. This is most definitely a family-driven project, and the state is, they are joining us on a monthly basis. They know about, where we're headed, what we're trying to do next. So we consider it a collaboration. And what plans do we have? In terms of plans, we're thinking about, again, this support broker role take on part of the responsibilities here? Again, it's not an end all, be all, save all, but could it help us move a little bit further down the line? So that's where we are here in Georgia.
Yeah, and I would say that you may have a sibling, a brother or sister that will take on this role, but probably realistically they'd be forced back into a traditional provider model just from the practicality of they've got their own life and this just takes so much time. And that's not what we want. And I think the state understands that. So to Rita's point, whenever we have a call, they're usually on it, and they've met with us and debriefed with us, and they're trying to help.
So there was a question about pooling funds together or leftover. Here it is.
Yep. So I was trying to organize. We got a couple questions in related to budgets that are similar. So what all are you able to spend your budget on? Related, do you have access to your entire budget, or is it restricted to Medicaid billing items only? And then there's a third question about funding. Is there any possibility of pulling leftover money from people's budget to fund sustainability?
I think that's a really interesting question. The second one, in terms of self-directing, of course, you all know it all depends on the individual service plan for that individual and the goals for that year. We can't direct in Georgia now behavioral support services. We must use a traditional model. Community living supports, community access individual. Those are some of the services that we can self-direct. Individual goods and services. I'm going to forget some of the categories, but you get an idea of what we can self-direct. Did I miss anything, Rick? The major categories are CLS and CAI.
Yeah, a bulk of it goes to CLS, just the care, getting them out in the community, and then CAI is a relatively smaller portion, then it drops off from there. But I would say that, if the typical budgets here, the top budgets you get, they provide 8 hours a day, 7 days a week. And as parents know, that means somebody's got to take the other 2 shifts, right? So self-direct only works to a certain point.
I thought pooling the leftover funds to fund sustainability. I would love to hear more about that. If someone would like to reach out to me, I'd love to know more about that idea or the possibilities there. That's interesting and very out of the box thinking.
Great. So I'll be on the lookout to see if anybody has any additional ideas on that. Next question. Are you aware of any sustainability service that you mentioned being offered in other states?
Other than support broker, I don't think we are, Rita. So
correct.
If that's a question in that there are, this person does have aware of other sustainability services, but you guys know the objective, those listening. It's, what happens when the parents are no longer here and we want to stay, the family, the individual wants to stay with self-direct. How do we do that? And that's what we're trying to solve. So maybe there's other solutions other than support broker, the path we're going.
Great. I know we just have a few more questions or a few more minutes, so I'm trying to just scan through.
And while you're doing that, Casey, if
Sure.
anyone has any ideas for us, or you're trying to start something in your state, please reach out to me. We are open to other suggestions, etc. And we'd be open to a conversation if you have other solutions. This is what how we're moving forward. But if someone else has thought of something completely different, then we want to know that as well.
Yeah, we really are not aware of anybody that solved this problem.
We did
If
receive
you've
a
solved this
comment.
problem, yeah.
Yeah, if you have
Let us
solved it,
know.
please let us
Yeah,
know.
let us know.
Yeah.
You can have your own webinar.
That's right.
We did get a comment back about pulling the leftover money. Someone commented, in New York, I know there are families who don't use all their budgets, and that money goes back to the state. It would be a matter of strong advocacy to get that money redirected to self-direction.
Yes, we agree. So if there's, we're trying to get additional funding because we use all our existing budgets for the caregiver portion of it, the actual DSP services. But yeah, certainly if there's anything left over, that would be a great use for it. But I don't know, the families I'm using that we're working with, we use just about every dollar.
That may be a great question to ask our partners in the state, Rick. So I've written that one down. So thank you,
Yep.
whoever brought that up.
Yep.
Right. And then here was a question / suggestion. Has your group considered incorporating the Charting the Life course framework or the STAR raft model into your work?
We are familiar with, I mean, not familiar, we have heard of, because of our new friends in Pennsylvania and other places, the Charting the Life course framework. Possibly we could look at that. I haven't delved deep into it, but I can. I have not heard of the STAR raft model. So thank you for offering that up, and I will do some research on that as well.
Okay, I'm just pausing for a moment just to see. I think we have time for one more question. We did receive a lot more questions about the Champions Place, and specifically around was there concern for the limits on the number of people with an intellectual or developmental disability to live in close proximity or under the same roof? Is it considered a community setting?
No, it's not. So that would be a longer. I'm not sure we have the time, Casey, to be talking through all that today.
Okay.
Thank
Great.
you.
Well, thank you to everyone. I'm seeing a lot of helpful suggestions that I'll pass along to you, Rita and Rick, along with some contact information. But thank you to everyone who submitted all of these questions. And thank you so much, Rita and Rick, for sharing the work that you're doing.
We're grateful for the opportunity. Thank you.
Great. Thank you, everyone. Have a great day.
Bye-bye.